Welcome again to the Digital Health Technologies Improving Outcomes in Pediatric Chronic Pain webinar. We're going to start now. My name is Mark White, and I'll be moderating the webinar today. I'm the President and CEO of the Canadian Institute for the Relief of Pain and Disability. Tanya Hyde, our project manager and the usual moderator, is also online, however, is recovering from a cold, which has left her speechless. This webinar is made possible through the support of the Community Grant Program through the BC government, as well as donations and membership. So we thank you for your support. As I mentioned, I'm Mark White, and I'll be moderating the webinar and handling the Q&A session with Tanya Hyde. Our presenter today is Dr. Jennifer Stinson. Dr. Stinson is the Mary Jo Haddad Nursing Research Chair in Child Health and a senior scientist in the Research Institute and a nurse practitioner in the chronic pain program at the Hospital for Sick Children in Toronto. Her research focuses on the use of and mobile health technologies to improve the assessment and management of painful childhood chronic health conditions. I am personally a great fan of Dr. Stinson's innovative and exciting applied research activities, and I'm very much looking forward to her presentation. So I'm going to hand it over now to Jennifer.
Great, thanks Mark for that introduction, and like Tanya, I'm recovering from laryngitis, so I apologize for my voice and I may have to stop and take a sip of my tea, but thanks for joining and thanks for inviting me to give this presentation. Let's just see. There we go. So in terms of the objectives of the session today, I want to give you an idea of what some of the barriers are to accessing comprehensive interdisciplinary care in Canada in the pediatric realm. I'm going to talk to you about the steps that I've done in developing some of my electronic and mobile health applications for both assessing pain and managing pain in children. And throughout my presentation, I'm going to highlight some of the opportunities, but also some of the challenges of using digital health technologies. So in terms of the problem, similar to adults, 1 in 5 children or youth in Canada suffer from recurrent or chronic pain, and we all know that pain can negatively impact all aspects of someone's quality of life and also has a significant economic impact on the system, healthcare system, and especially the patients and their families. In Canada, until recently, there was a big lack of pediatric multidisciplinary pain clinics. There were approximately 8. At the end, I can talk a bit more about the initiative in Ontario, but there are now 3 other centers in Ontario providing pediatric pain care, but most of these clinics still have 4 to 6 month waiting lists to be seen. And also with chronic pain, we have a problem with the current assessment tools that we're using, and that we really lack measures that can help track pain and functioning over time in everyday settings which young people are in, such as home and school. So as Mark said, part of my research area focuses on the use of and mobile health technologies to really harness the potential of these technologies to promote things like patient self-management, providing patients with the knowledge and skills that will empower them to be equal decision makers with their healthcare providers and improve communication and be equal partners in that shared decision making. And similar to adults, young people that have painful chronic health conditions or chronic pain really don't know anyone else that has a similar condition, and so there's a real need for peer-to-peer communication and support which can be provided using e-health. Mobile health is basically the term of providing medicine or public health using mobile devices such as smartphones or tablets. And there are four big buckets of areas that they're being used. They're being used to collect big data in terms of community and population level health. They can be used to deliver information to healthcare providers, for example, for example, dosing apps. My focus is more on using these technologies to help monitor in real time patient symptoms or functioning, such as pain, their exercise, their ability to socialize, go to school, those types of things. And then also to provide direct care, and in my case, providing chronic disease pain self-management. And these, whether it's done via the web or through an app, can really improve access to appropriate and timely chronic pain care. So I'm also focusing on this because e-health and mobile health is really integrated in young people's everyday lives. Teens are wired. The stats are probably higher, probably 50 to 60% use the internet daily. About a third of them use it to access health-related information, usually related to mental health issues. 84% of teens own at least one personal media device, and the number of teens that have smartphones has really grown over the last few years. So the first area I'm going to talk about is how we can use these technologies for better assessing chronic pain. So the old way of tracking chronic pain in patients was asking them to fill in paper diaries. And we know that this is problematic. Arthur Stone did this beautiful study where he fit a paper diary with a photo sensor. And so every time the patients opened it up to fill in their entries, they could track that. And he asked patients with chronic pain to do this twice a day for a month. And only 11% did it daily. The majority of patients filled it out just before they were coming back to the clinic. So we can see that they're very problematic in terms of really having reliable and valid data. So in my lab, we've moved over to using web and smartphone-based pain assessment tools. So electronic diaries or real-time data capture is really a family of techniques that are used to collect data about an experience, in this case chronic pain, as it unfolds naturally in a person's life. And it can really help to avoid things like recall bias and provide more accurate and valid responses. So the first tool I want to talk to you about is a tool that was developed by Chitra Lalu, who's a postdoc researcher in my lab, and this is from her PhD work with Dr. Jim Henry. She developed a web-based tool called Pain Quilt, which was really a tool to help mapping using iconography to actually help people describe their pain. A lot of people find it really difficult to use words to describe how their pain feels. And so it tracks the quality of pain using validated icons, and I'll show you the tool in a second. It can track intensity of body sites using the typical 0 to 10 numeric rating scale. There's a codified body map, so it can really precisely tell where a patient hurts, and it can time stamp the records. And so over a course of studies that she's done, she's has evidence that it's both usable, clinically feasible, and has the beginning convergent validity. She's tested this both in adolescents with arthritis and chronic pain, as well as adults. So this was a study that she did here at Sick Kids and in an adult center in Hamilton, looking at validating or testing the usability of this tool. And so this was a sample of 30 adolescents and adults with arthritis pain. And the key findings from this study was that it had high usability. People found it easy to use with minimal instruction, and it took less than 5 minutes complete. There was evidence that the icons are representative of word descriptors that we use in other tools like the McGill Pain Questionnaire, and that all of the patients thought this was a valuable tool to help them communicate better about their pain with their health. So this is the web-based beta version of Pain Quilt, and you can see that patients can mark on their body locations. You'll see the quality descriptors here for aching, burning, dull, throbbing. They can choose their pain intensity and then drag it over to the body to highlight where they hurt. And then here you can see there's a pain intensity of 6. It feels dull. And then there's pain in the right elbow, and that intensity is 7, but it's more stiff. And then people can rate the impact of their pain on various aspects of quality of life. So the next tool I want to move on to is a smartphone app that we've developed in my lab called Pain Squad. And Tanya sent out a link for a video on Pain Squad, so hopefully people were able to have a quick look before they joined on. This work was funded by the Children's Cancer and Blood Disorders. The app was developed by Kandari, and some of the phones and data plans were provided by TELUS and Fido. So in terms of why I decided to start with cancer pain in terms of building an app is that pain is common across all types of childhood cancer, and people can have pain obviously on treatment and off treatment. And there's been studies that looked at kids after they've had treatment into adulthood, and about a third of them are still suffering from chronic or recurrent pain. And up to 70% of children are going to experience moderate to severe pain at some point during their cancer treatment. And like any type of pain, pain is especially distressing for children with cancer. Despite this, though, there's a lack of really well-validated multidimensional pain tools. There's a lot of symptom assessment tools that look at nausea, fatigue, those kinds of things, but in terms of a well-validated specific pain tool, there isn't one. So I developed Pain Squad using a phased approach. I had previously, for my PhD work, developed one of the first web-based apps for youth with arthritis, and so we modified that by bringing in a panel of experts in pediatric oncology and pediatric pain, and that was funded by CIHR. We did a scoping review of all the apps that were available, and I'll show that data to you in a minute. We then developed the app. We tested its content and face validity. We then underwent a study to check its usability, making sure that young people, because this was developed for 8 to 18-year-olds, that it was easy to use and understand. We then wanted to check the feasibility in terms of compliance and ensuring there was no technical issues. And then we really wanted to make sure that this was going to be a reliable and valid tool, and so we did a study on that, and I'll go over some of the data from that. So this is the scoping review that was led by Chitra Lalu in my lab, and we finished this in 2014, so it's outdated already, but at that time there were just under 300 pain apps, and we assessed the content and functionality of them, and the majority offered basic skills support regarding managing pain. About half of them provided pain education. It's interesting, only about a fifth of them actually provided self-monitoring of pain and other things such as exercise or mood, and very few provided any type of social support. What was really concerning to me as a clinician and a researcher was that the majority of these apps are being developed by programmers without any input from clinicians. Only 23 of the 279 had involved healthcare providers, so that's quite concerning. And only one of the apps actually had any evidence that it actually made a difference in terms of improving outcomes or that it was validated. So The next thing we did was usability testing, where we had 20 teens come into the lab and complete the diary. They found it was simple to use, really satisfying to complete, but they did identify some issues that we needed to change. Some of the wording was confusing. Some of the buttons in the app were not ideal for in terms of ease of use, and some of the kids wanted to be able to show where their port was on the body diagram, so we added a section for that. And then we tested it out with another sample of teens, and there were no new issues identified. This is some of the qualitative data from the teens that we interviewed, and one 13-year-old female said, little kids can relate to it. It's not too babyish for us older kids, and it's not just like writing on a blank piece of paper or anything, so it's pleasant to do, and it asked me the same questions they asked me in the hospital, so that's really good. The next thing we did is that we sent the app home with a sample of teens again, around 25, and we asked them to do it twice a day for a 2-week period. And this testing identified some issues, and I should have known this, being a parent of 2 adolescents at the time, that teens don't want to be beeped to fill out their entries at 8 a.m. on weekends, so we modified the settings for weekdays and weekends. But what was really great for us to see is that we had really high adherence. So these are kids that were on active cancer treatment, and we had almost 90% compliance for the 2-week period. And if you've seen the video of Pain Squad app, this concept of gamification, which I'll touch on in the next slide, I think really helped with that. And we had really high acceptability. So we used gamification in the app where the teens, when they started using it, they started off as a rookie in police force, and the more assessments they completed, they would get a little video message from one of the characters, actors from Rookie Blue, or I'm blanking on the other TV show, Canadian TV show, but anyways, and then they could level up to be chief of the police if they completed all entries. And so I think that using sort of game thinking and game mechanics really can help internally motivate people. In the past, researchers would pay participants to incentivize them to complete that, and obviously from this study you can see that this gamification really helps with compliance. So in terms of the psychometric testing, we did a couple of studies. As I said, we wanted to determine the construct validity and reliability of the new tool, and we wanted to make sure that it was responsive, that is, it's able to detect change in pain when we know pain should get better over time. For example, after surgery for a tumor resection, that pain over time should improve. And using both studies, we looked at the feasibility and acceptability of the app. So in terms of the results, this study was in 101 patients from 4 centers in Canada. We demonstrated convergent validity by showing moderate to high correlations between weekly ratings done on the Pain Squad app and by their weekly recalled worst, average, and least pain. We also correlated the ratings on Pain Squad with other constructs such as health-rated quality of life and pain coping. And again, we predicted sort of low to moderate correlations, is which we found, and that we found that it had internal consistency in terms of all the items within the tool were measuring the same constructs in terms of pain. In terms of the actual descriptive data that we collected from these teens, you can see that pain occurred on 93% of the entries, Current pain was in the sort of moderate range at 4.2 out of 10. Worst pain was 6.1. You can see that this pain is quite bothersome, and it is interfering with activities of daily living. The other thing the Pain Squad tool tracks is things like what medications and physical and psychological strategies they're using. And you can see that despite having frequent pain, only 50% of teens or young people are actually using medications for their pain, and far fewer of them are actually using physical or psychological strategies to help them. So in terms of responsiveness, we did show large effect sizes between baseline, which was a week before surgeries, and the first week and second week following surgery, when you would expect pain to resolve. In terms of feasibility, in study 1, which is the 2-week period, the overall adherence to the protocol was about 72%, and in study 2, where they had to do it for 1 week before and 2 weeks after, you can see that the overall adherence was a little lower due to the longer period of time of using the app. The teens really liked the aesthetics. They found the app quick to complete, and it interfered minimally with their activities of daily living. So in terms of the implications, I think these real-time applications can really help us to better understand the day-to-day symptoms that children with cancer have, especially in terms of pain. And I'm really think it can help us better optimize the care that these young people receive and improves their quality of life. And now that this tool is freely available, it's being used clinically, and people are now starting to use it in research contexts to evaluate treatments, both pharmacological and looking at sort of the non-pharmacological. So as I said, Pain Squad is available in the Apple Store to download for free. So I'm going to move on now to looking at some of the applications we've developed for chronic pain. So I've just told you about Pain Squad and how it actually was just a tracking tool, and the kids said this would have been great if we actually could get advice back in real time to manage our pain. So we've built Pain Squad Plus, and this is the project of Lindsay Jibb, who's a PhD student in my lab, and this project was funded by CIHR and Alex's Lemonade Stand. So Pain Squad Plus app does 2 assessments twice a day, and the kids can do ad hoc assessments if they're having pain at other times throughout the day. Based on their pain assessments, they are given self-care advice based on a standardized algorithm that we've developed, and they mainly get advice related to physical and psychological strategies, and there is some very generic advice about medication. There is support from a healthcare professional, so we built in an alert system if they have 3 episodes of severe pain that's poorly managed. An alert will go to the RN, and the nurse will call the patient, and then the app will reassess after it's given advice to the teen to get them to re-rate their pain ratings. So the steps, again, in the development of this, so you can see that we were using a similar phased approach. The first thing we did was that we really wanted to have evidence inform our algorithm, and so we did a systematic review of the pain strategies, focusing on physical and psychological for cancer pain in children. We then held a 2-day consensus conference, which was funded by CIHR, where we brought in oncology and pediatric pain experts. The next thing we did was we got the funding to build the app, and we did usability testing. And then Lindsay's currently doing a feasibility study right now, doing a pre-post test where the kids are using it for a 28-day period. This is the dashboard that the RN in this study would see, and because we have this alert, this app would be classified as a Class 2 medical device, and would need to be we would have to get a license through Health Canada for that. So that can be a barrier when you're developing and wanting to implement and sustain these types of apps. This is just an example from one patient to give you an idea of the type of data that can be gleaned from this. So this is actually a patient I was following in the chronic pain clinic who had neuropathic pain from his chemo treatment. And so you can see the severe episodes of pain that he's having on a daily basis. And then when he started various medications for his pain. And then you can see much quicker which medications are working and time to resolution of pain with apps like this. So again, this is some data from his individual diary looking at how his pain impact aspects of his everyday living, such as sleep. And you can see that it's really impacting his emotions and enjoying life. So that would actually, with these ratings, push more advice in terms of psychological strategies. And you can see the psychological and physical strategies he used. He was given during a 28-day period 212 strategies, and you can see he rated their effectiveness, and he was using things like cold and imagery and heat to help with his pain, and he found them effective. These are some of the, we're doing interviews with the teens who've used the app, and these are some of their qualitative comments. One said, I liked how the app would suggest things like relaxation and breathing and tell you how to do that, and then you can click on it and there's like someone talking to you. So they can actually click on guided imagery and progressive muscle relaxation audios. It helped communicating with the pain team because I could remember what I put into my pain case, and then I'd think back, what did I say, and then I'd remember and tell the pain team. And then another one said that they really liked the questions. They were easy to understand and straightforward. Now I want to move on to another program. I've developed a couple of web-based programs to help young people manage chronic health conditions where pain is a big aspect of that. And this work's been funded by the Canadian Arthritis Network, NIAMS in the United States, and CIHR. So in terms of internet-based self-management programs, there's lots that have been developed for adults, and they're basically taking what we know that's effective from face-to-face and cognitive behavioral therapies and then transforming them for delivery via the internet. So they tend to be highly structured. They can be self-guided, which means the patient walks through it on their own, or they can be guided with what I call sort of a virtual coach. They can be, those that are more effective tend to be those interventions that have some personalization, or you're able to tailor it to the end user. Again, the more interactivity it has, those tend to have better results in terms of health outcomes. So you'll see in the program we have extensive animation, graphs, quizzes, discussion boards, and video clips of teens used so we can use pure role modeling. So the potential benefits, it really gets at some of those access issues in terms of it reduces the inconvenience of young people having to come down to the hospital to receive this type of therapy. And it may increase their willingness to seek help, especially around some of the psychological strategies. And again, we can quickly disseminate chronic pain information and education and provide it 24/7 when patients are ready to sort of absorb it, and it may improve compliance. So again, you'll see a theme. I sort of develop my projects in a phased approach. So we first started with the needs assessment. Because we can develop mobile apps and these technologies doesn't mean it's the proper solution for the end user. So it's really important to do that needs assessment and then develop it and do the usability testing and the feasibility testing and then really testing to see if there's evidence of its effectiveness. So we did a qualitative study with teens with arthritis, their parents and healthcare professionals, and we asked young people what do they need to know and receive in order to sort of gain control or be able to self-manage their condition. So they gave us some clear messages. They said in order to gain control, they need others, such as healthcare professionals and their parents, to let go. And the types of knowledge and skills they wanted were knowledge about, obviously, arthritis. They wanted knowledge and skills to be able to make decisions with their healthcare provider. They wanted techniques about how to communicate more effectively with their providers, and techniques obviously for managing things like pain and emotions. And they all talked about wanting the opportunity to connect with other people that have arthritis. So we use this information to really develop the online program. So the three main components are disease-related information. The bulk of the intervention is self-management skills, and then there's opportunities for social support in each of the modules. So there's 12 modules. So you can see there's stuff about arthritis, how it's diagnosed, managing symptoms, managing stress, learning how to relax, medications, distraction, transitioning, those types of things. And there's 2 modules for parents, and we have health coach support, which is weekly or monthly telephone support, and the program currently is available in English, French, and Spanish. This is just a screenshot of the disease-specific education, and you can see we're using a lot of images and different techniques to convey the information, because teens clearly told us they're not going to scan through tons of information, so just give us the facts and right up front. So this is just a screenshot showing about the main facts about systemic arthritis. This is a click-through animation on how we feel pain, because a lot of the kids talked about pain and how 2 people with arthritis can have the same type of arthritis but have totally different pain experiences. And so this helps to get across the complex interaction between the brain, and then how some of the techniques that we're suggesting can help modulate the pain response. There's a whole section on managing pain, going through pain coping skills such as belly breathing. There's guided imagery and progressive muscle relaxation. There's a whole module about emotions and the connection between negative thinking and stress and physical symptoms. So this is just another click-through animation about that. So in the usability testing, again, this is where you bring teens into the lab, you get them to walk through features of the online program, and they really liked the layout, that it was easy to navigate. They found it visually appealing, and again, you have to know your end user, so arthritis is much more common in females than males, so we geared it more to a female audience. They really like the features to allow them to interact with other teens, and they really like the content in terms of its completeness, easy to understand, credibility, and highly relevant to their disease. But the testing did uncover formatting and navigation issues, mainly around medications. The teens only knew the name of their med, like naproxen, and didn't know it was an anti-inflammatory, so we had to redesign the navigation for the medication section. Participants for the physical therapy section wanted much more videos on how to do specific exercises. We added yoga because there's some new evidence that yoga is particularly helpful in arthritis. They all stated that the program was really easy to use, and all of them said this would have been so helpful to have when we were first diagnosed. For the feasibility study, we did a pilot randomized controlled trial where we randomized 46 patients to the treatment intervention or an attention control group, which was basically 12 static sites that are publicly available that we wrapped into a controlled website, and the teens were asked to do this for 12 weeks, and then we did pre and post intervention outcome measures. And so this was the results, and we were really doing this to look more at feasibility. So would teens come into the program, would they stick with it? But we found that those in the experimental group, the teens taking charge group, had significantly higher knowledge about their arthritis and lower average weekly pain ratings compared to the control group. And we really didn't expect to see differences in health-related quality of life or self-efficacy, because it takes time to sort of incorporate those skills that they're learning integrating into their everyday life and routine. So those would be, we'd expect to see more at, say, 6 or 12 months. But what we saw was really high compliance with completing the modules. We had 91% completion rate. We could track where they went, so we saw that they used the communication features such as quizzes and goal setting. And it's interesting, although the kids wanted the discussion board, probably it's similar to other research in this area, probably only a third of them actually used it, and of that third there was probably only about maybe a handful that really were super users, and the others would be what I would call sort of lurkers, just checking it out but not posting. So in terms of where we are now, we just completed 2 large multi-centered randomized controlled trials, one in Canada at 11 sites, and then one in the United States testing the English and Spanish version. The 12-month follow-up is ending this month, so we're actually just making modifications to the program, and we'll be launching it, a self-guided free program in the new year. And I can alert you guys to when that's posted. But in my lab, we're really trying to develop these online programs so that all young people with these painful chronic conditions, this should be a first step for everyone that has a condition. And then obviously it's not for everyone, and there are going to be people that are going to need more intensive therapy, whether it be face-to-face or whatever. But at a minimum, everyone should be receiving this kind of psychoeducation. So the last project I want to talk to you about before I lose my voice is I Can Cope with Pain app. And this is an integrated smartphone and web-based self-management program for youth and young adults with chronic pain, 15 to 25 years of age. And this is a project that's been funded by CIHR. And Chitra Lalu, who's my postdoc, this is her project, and these are the co-investigators from the 4 main adult and pediatric sites across Canada. So youth and young adults, and we're targeting those between 15 and 25 who are really what I would call emerging adults, because these kids tend to be at high risk for getting lost, especially between transition from pediatric to adult chronic pain centers. And they face not only dealing with their chronic illness, but the unique developmental tasks of, just the changing brain and the executive functioning skills that are required for self-management, social development issues, and learning how to navigate the healthcare system. So in terms of barriers to chronic pain self-management, the majority of these young people with chronic pain never receive comprehensive education or skills training to promote disease self-management. And I've already sort of touched on this, that there's a real shortage of dedicated pain treatment facilities, and it's difficulty accessing services. For example, we have a transition clinic at SickKids to help transition kids when they go off to university or to the Wasser Pain Center. But we have to start this almost a year in advance to ensure that there's no delay of these kids once they turn 18. And so it can be quite problematic. And these are kids that are in the system. So there's a lot of kids with chronic pain that aren't even in the system that won't have access. And again, the cost of these therapies. So a lot of the physical and psychological therapies that we know are best practices, there's a real difficulty of patients and families accessing them due to cost. So to address this, we're in the process of developing I Can Cope, and it's really to help them better understand their condition and help them develop healthy pain coping strategies that they'll be able to use across their lifetime, because we know that about 60% of young people with chronic pain are going to continue having chronic pain as adults. And we really, again, wanted to provide young people with social support with their peer group. So in terms of the development, in phase 1, we did do that needs assessment with both adolescents and young adults in 3 centers in Southern Ontario. We're currently developing and refining the app prototype, and we're partnering with the Center for Global eHealth at UHN to build it, and then following the usability testing, we'll be evaluating the app in a pilot double-blind randomized control trial over a 2-month period. So I'm just going to go through quickly the architecture of the I Can Cope. So in terms of the app functionality, it's going to have self-monitoring of symptoms, and I'll show you some of that in a minute. There's going to be a goal-setting function to help improve function. There's a coping skills toolbox, which really is going to be tied to their symptom tracking, and a social support feature. And then this is paired with an educational website that will provide more in-depth education about different types of chronic pain, how it's diagnosed, and the bulk of it will be on management, similar to the content that was in the arthritis program I showed you, and that's being developed by About Kids Health. And I'm partnering with these two groups strategically to ensure the sustainability of this application over time, which I'll talk to you at the end, is one of the challenges in this area of research. So in terms of the symptom tracking, they're going to have daily check-ins in terms of things such as pain, sleep, food, mood, activity levels, and energy. But pain is really low on the totem pole in terms of tracking. We're really focusing on function in terms of tying that to the advice and really putting a focus on tracking function versus pain. And so we're actually building a profile where they can sort of talk about what are the big challenges with pain. And for example, if sleep isn't an issue, they won't be sort of pushed to track their sleep. So it's really going to be tailored to the individual needs. The symptom monitoring will be able to push back to them so that they can actually help to identify trends in their function and in their pain, and how this relates to the strategies that they're using within the app. So throughout the app, the use of the app, there will be goal setting, and this will be revised on a daily or weekly basis based on their goal. So they can set, there's going to be some standard goals, and then they can pre-populate their own goals. For example, walking, breathing, relaxation, those types of things. This is just a mock-up of the coping library. So this will be accessed at in-the-moment coping strategies, and they'll also be push strategies based on what they enter into their daily tracker. And then they'll be asked to sort of evaluate those strategies, and they basically can like them, and they can share what strategies they're using in the social networking spot as well. So this is where they can connect with other young people who are using the app. There will be daily curated questions to help promote discussion, and this is based on our experience with the arthritis module, our program, where people really weren't using the discussion board. And so co-creating this with the teens and young adults that are helping us on our team, this is what they thought would be really helpful, and then they can share what strategies they're using as well. So just to wrap up here so that we can have some time for questions, I think you can see obviously there's lots of opportunities by using this to really improve especially access to young people to this type of care, but it doesn't come without challenges. So really within the field of mobile health, there aren't really clear guidelines, although there are some groups working on them in terms of what are the steps that need to be done to develop apps to ensure that they're incorporating healthcare providers, that they're actually evidence-based, and they have some evidence that they actually make a difference. Right now, we really are stuck with either native apps or web-based designs, and web-based designs aren't really responsive enough across all the different types of mobile phones we have right now. But the landscape evolves really quickly, which is also a problem as well. So once you develop something within a year, it could be out of date related to the ever-changing technology landscape. They're not inexpensive to create. So, for example, Kandari, who built Pain Squad, estimated, although they did most of it in kind, that it would have been just under $100,000 to develop with all the gamification, etc. Another big issue is sustainability. So here, as a researcher at Sick Kids, we don't really have a mobile health strategy, and due to funding cuts, we've lost some of our programmers. So that's now why I'm co-creating my apps with Dr. Joe Cafazzo at UHN, where he has a team of 80 designers and developers and that can help ensure the sustainability, especially of the apps, native apps over time. Again, when we're collecting personal health information, we have to ensure that there's features and functionalities within the app to do that, that the data is encrypted, etc. Right now, a lot of these mobile apps that are out there aren't integrated with our electronic health records or systems, but in the apps that we've created, we at least have the ability to generate PDFs, which then people can send to their providers, which then could be stored into the medical records. I think our lab is investigating the notion of gamification and how we can use that to more internally motivate people versus other mechanisms of trying to get people to do these apps or assessments on a regular basis. And then you can see from that one example I showed you from the one patient that we get a huge amount of data back, and sort of garbage in is garbage out, so we have to make sure that the data we're collecting, that we're asking really just only the essential information that we need to collect, and that it is a bit more challenging in terms of analyzing the data. So in summary, hopefully I've demonstrated to you that smartphones and internets applications can show great promise as a mode of not only tracking pain, but also allowing us to deliver tailored self-management programs to young people. And we're evaluating as well sort of the economic impact of these apps. For example, Pain Squad Plus, and does it help decrease, for example, emergency review visits and things like that. And again, I'm focused on this because young people are early adopters of this technology, and it's an integral part of their everyday life, so why not use that and harness that potential? It can really increase the reach and make this evidence-based stuff that we know works more accessible to everyone and increase the reach. And again, what we're trying to do in our lab is not recreate the wheel, so we know sort of what features and functionalities of these programs people really like and seem to have the best benefits, so we're trying to reuse those components and just adapt it for other populations instead of reinventing the wheel. And I'm partnering with other groups, for example, in the UK, Norway, and Finland to actually culturally adapt them to other, not only culturally but linguistically, instead of reinventing the wheel. So as I said before, I really think these are a first step in an approach to healthcare where we can make sure that everyone with painful conditions can get access to these types of therapies. So the last slide I want to show you is just my research team, because I wouldn't be as successful and productive as I am without the students and staff in my lab. So at that point I'll thank you, and then I'm happy to answer questions.
Wow, Jennifer, that's so impressive, your work, and I just want to congratulate you. It's fantastic the care and attention you've taken to the development of these various apps. We do have questions, and I would also welcome people to add any additional questions to the question box. And so why don't I start with the first question, which is, when will the Pain Squad app be available for Android platforms?
Good question. I do have a programmer now who's working on that. So we're hoping in sort of April of next year that we'll have an Android version.
And related to that is a question, is the team having an app programmer in the team or contracting the services?
So I have a staff member who's point 0.6 on my team, and that happened when the hospital, we did have a programmer who was helping some of the clinicians and researchers here that were developing pediatric apps, but that position was cut, so I actually had some research funds that I cobbled together to hire my own programmer to ensure the sort of viability of the stuff we're creating in the lab.
And then, is there some comparable app that you would recommend for adults to use?
Off the top of my head, I'm blanking on it, but if people look up in the Clinical Journal of Pain, there actually have been 3 scoping reviews on pain apps. In each of those reviews, each of them cite a few different ones that they would highly recommend based on the features and functionalities, and I'm sorry, I'm just blanking on what the name of the 2 apps were that we recommended in our paper, but I can, if you want, I can actually send a copy of the paper to Tanya and she can send it out.
That sounds fabulous. Yes, and any other resources that you would like to add, we can add those resources when we send out the notice of the presentation when it's available. Are you going to be making I Can Cope with Pain into a video game was a question.
That's a good question. Right now it's just being made for iPhone and Android apps. I am building a video game for younger kids with arthritis to help them learn, sort of 8 to 11-year-olds, to help them begin to learn about some pain and symptoms, and it's been a huge learning curve for me in terms of building a game, and it's a different skill set than sort of building apps. So right now we're not thinking about that, but who knows, I may venture to develop another game, but right now I'll see how this first one goes for kids with arthritis, and then we'll see.
So there were a few other questions. I'm just going to go to them. One was, is there a comparative pain analogy developed that can be used to ameliorate the subjectiveness of the existing 1 to 10 scale, such as e.g. a bee sting representing a particular score. I think that was that it may be done somewhat with the icons that you have been using rather than the 1 to 10 scale.
Yeah, the icons were really developed because from people saying they had when in the clinic, just clinically observing, people struggle not only with the 0 to 10, but they struggle with how to describe in words what their pain feels like. And so we're actually sort of trying to look at something like that in pain and I Can Cope, because the 15 to 25-year-olds hate using the 0 to 10 scale. So we're trying to come up with something else. Not like an icon, but something different, and we're still trying to work that out because they really don't like doing that. So I'll keep you posted on what we come up with. But one of the things I really try to do in my research is really involve patients in the co-development of this. So every step of the way, we've had a group of young people who've been involved in our research that have stayed a part of the team. And so when we're trying to decide these sort of things, we actively involve them in the team on emails about how should we word this, etc., in the apps. And so I would encourage others to really think about actively engaging patients in not only the development, but all aspects of research.
How appropriate would the teens taking charge be for kids with chronic regional pain syndrome?
It's it's built for kids with arthritis, but a lot, so the I Can Cope with Pain app would be appropriate. And we are working on building a resource. There's a About Kids Health as a resource module on pain, and we're actually revamping that. And it has a lot of the sort of basic elements of the Teens Taking Charge Arthritis program. But it'll be freely available in the new year, so the arthritis one. So if people want to use it, a lot of the skills in terms of, you know, the physical exercises, the psychological exercises are the same despite whatever type of pain you have.
And a similar sort of query, when will the website Teens Taking Charge, or it could be a different website, include cancer and other diseases, disorders?
Okay, good question. We are we have developed a cancer one, and we're doing a randomized study right now. It'll be starting actually in January at 4 of the children's hospitals in Canada. And there is one for hemophilia, and that's freely available if you go on the About Kids Health website. And then there's one for solid organ transplant, and that's being evaluated as well.
Wonderful. Okay, so I'm just going to thank you once again, Jennifer. What a fabulous talk and a great body of work.